To protect our most vulnerable, caregiver backgrounds need to be checked efficiently, effectively, and quickly within each state and often across state lines. This is why the National Background Check Program is so important. Designing and launching a successful background check program requires collaboration across state agencies and communication with all stakeholders. This is Connecticut's story.
Our program in Connecticut has always been designed with a couple of interests and points in mind. It's protecting the public while providing the employer with an informed hiring decision and allowing their processes to move smoothly and efficiently. We don't want to present undue burdens to the hiring process while protecting patients and the public. Background checks that were performed through the Department of Public Health were very labor-intensive, and fingerprint checks were done in a much more manual format, heavy on paper, ink and roll prints. Fingerprints are pressed. Those then go to our state police for scanning and uploading into a more automated system. You might be seeing 30% of those rejected, which means that person has to go back and get re-fingerprinted, which also might be rejected. Once receiving the award, we started to work within the state, both with our stakeholders in the long-term care industry and sister state agencies. One of the very useful things in having this grant and working with the CMS was building off the experience that other states had had as part of the pilot program during the Medicare Modernization Act. So upon receiving this grant, we took a look at the experiences that those states had had, as well as their enabling legislation, and we tried to craft a program that would address preemptively some of those concerns and issues that they had faced as part of the pilot program. In doing that, we developed a 2-page fact sheet for the stakeholders and industry representatives that really envisioned a program based upon the experiences of those pilot states. That proved to be very effective in addressing preemptively concerns that others might have, and ultimately the program that Connecticut has put in place closely mirrors the initial vision that we had.
We did a phased-in approach with our long-term care facilities. So CMS had advised us to pick one group to go first. We've done that and it's worked really well. We started with the skilled nursing facilities, and then several months later we phased in the home health agencies. It also helped with the state police as well in terms of the volume. So it was a win-win all around.
As part of this program, live scan machines that are integrated into this background check system have been installed at each of our state police troops and our Middletown, Connecticut headquarters. What this allows is for a fully automated integration into this background check program. Going from an ink and roll system, or a much more manual and paper-intensive background check system, to the fully automated live scan paperless system has a number of benefits that hopefully Connecticut will be able to build to other programs.
It's a really intuitive system. It's very user-friendly. There can be connected applications. So meaning if facility A already put an applicant into the system, they can go in and search by someone's last name and social security number and pull up the information on that applicant and process that person. So essentially if an applicant had been fingerprinted and marked eligible within 3 years, they don't have to get re-fingerprinted again if they change facilities. There's no limit to how many facilities an applicant can work at within those 3 years. We're
coming up on our 1-year anniversary this fall, and it has proven to be a highly effective, efficient program. The failure rate or reject rate of fingerprints under our current program is less than 1%. With over 88% of our background checks having no criminal record whatsoever, it results in an effective and efficient fingerprint result, fully accurate, and allows that individual to proceed with their hiring and employment process rapidly. The core background check system, frankly, sells itself. It is certainly in Connecticut, I think we feel a real sense of pride in what we've accomplished, because this type of system truly will protect patients and clients. It is something that should be in effect, frankly, nationwide.